So the trees are turning, looking out the window, so fall is here, getting a little bit cooler. Which means respiratory viral season's coming down the pike. Right now, though, we're in a bit of lull, at least for COVID. And I guess it's a little bit of a sad thing when you can reflect back on 3 falls of COVID data. But this is our 3rd fall living with COVID. And like the other falls, October has been a bit of a lull for us. We had our BA4 and BA5 mini surge, mini wave in August. Cases have been coming down since about Labor Day. And it looks like they're kind of plateauing in a trough right now. And that's good. It's about as low as it's been before for COVID. The wastewater also looks pretty good right now, but it's a little bit of a calm before our respiratory viral seasons. In the past 2 years, getting into November, later November, and into December, cases of COVID went up, and that's to be expected because that's usually when we see our flus and our colds and our other viruses that are spread through the upper or lower respiratory tracts. So enjoy the lull right now, which means we got a little bit of time to do some housekeeping with COVID, and we'll talk about what that housekeeping with COVID might be in a minute. Schools and colleges are doing relatively well, but I can tell you that there are a lot of colds going around, and there's a lot of colds that are associated with some pretty bad sore throats, sometimes with what we call conjunctivitis, which is some redness and inflammation in the eye, both eyes. So you might call that pink eye, but when you have both eyes involved at the same time as a cold, rather than being a bacteria, that's a virus, and it's usually adenovirus. So we keep track of what viruses are circulating through our laboratories here in Forsyth County at Atrium Health, Wake Forest Baptist, and then we also keep track in other hospitals throughout North Carolina. So we have a little bit of a good idea of what's circulating. What is not circulating right now, at least up here in the Triad, is influenza yet. So influenza may be lurking behind that ghost or the skeleton that's out in the front lawn getting ready for Halloween. It's out there, but we haven't been seeing any cases of it yet. So what would be the housekeeping that we should be doing now when things are low? One is get your shot, get your booster shot. So it's time for your fall flu booster, and those are now available. And it's a great time to get it now before the flu season starts. And then the other thing is you can get your fall COVID booster. And as we've been talking about the last few times, the fall COVID booster is enhanced for Omicron, particularly BA4 and BA5. Why is it important to get the fall booster? Is because the immunity that you have gotten from either past vaccination or from getting infected is not as good against BA4 and BA5.